Okay, let's unpack this. For decades, when we talk about mental health globally, we often frame it, as a social burden, maybe a healthcare expense or a humanitarian thing.
Right, the cost side.
Exactly. But the sources we've got today, really fresh, critical insights from the McKinsey Health Institute, they frame the issue fundamentally differently
How so?
as a core driver of global economics and growth. This isn't just about saving lives, they're arguing. It's about powering up GDP.
That's a big shift. And our mission today is really a deep dive into that specific document, right? The September 2025 MHI paper, the new case for brain health, scaling interventions for health and economic growth.
Which was developed with the Clinton Health Access Initiative, CHAI.
Correct. And this source material, it really represents a profound shift in how we analyze health on a macroeconomic scale. It's not just cost containment anymore.
Yeah, the central idea here is incredibly bold. They're basically asking what happens if we stop seeing brain health as just something to manage and start looking at it as an actual investment.
Like infrastructure or education.
Kind of. So our mission is to understand how scaling simple, effective, and crucially cost-effective health interventions can, transform economies and maybe avert a truly monumental global disease burden.
And what's fascinating here is that MHI and CHI, they aren't just documenting a huge global problem. We know it's huge. They're trying to provide the blueprint for the solution.
Okay.
Their entire focus is on identifying these opportunities to massively reduce the global burden from brain health conditions and the related non-communicable diseases, NCDs.
Right. The NCD link is key.
It is. And the goal isn't just healthier communities. It's measurably stronger economies that they argue follow as a direct result.
Okay. That immediately flags something we need to clarify for this deep dive. When MHI uses the term brain health, what exactly are they covering? It's not just depression, right?
No, definitely not. And that's vital. The scope they use is explicitly comprehensive. We're talking mental disorders, neurological disorders, and substance use disorders.
So everything from anxiety and schizophrenia to epilepsy, dementia, and addiction issues.
Exactly. It's a unified, sort of holistic view of the health of the entire nervous system. They recognize how interconnected these challenges are.
Which makes sense. For too long, these have been kind of siloed in policy and treatment.
Right. But MHI is treating them as one big strategic priority area.
And their point is that the burden from these conditions, which hits productivity, life expectancy, national budgets, it doesn't have to be this permanent drag on the economy. They're pushing proactive, proven solutions.
Absolutely. The core solution they're really hammering home is the scaling of known, cost-effective interventions. They're not waiting for some miracle cure down the line.
So existing stuff.
Yeah, existing proven stuff. And when they say interventions, they mean the whole spectrum of care. Prevention strategies, making treatments accessible, and having robust recovery support systems in place.
Full life cycle.
The full life cycle. They argue that these existing strategies are the necessary and, importantly, the immediate path forward to get large-scale change.
It sounds incredibly ambitious, scaling these globally, but the sources do confirm this whole project isn't starting from absolute scratch, right? It builds on earlier work.
Correct. Yeah, they didn't just wake up one morning and decide this was the key to global growth.
Yeah.
This 2025 document, it follows up and really deepens the analysis of a pretty substantial 2022 report.
Ah, okay.
That one was MHI with the Healthy Brains Global Initiative. And that earlier work already established the sheer weight of the global burden and the potential that proven strategies already hold.
So this new report.
This new one refreshes the data, it provides more granular regional detail, and crucially, it sort of cranks up the volume on the economic urgency to act now.
Okay, that foundation is really key because now we get to move from the strategy argument to the hard data. And this is where it gets really interesting.
Yeah.
Because MHI and CHAI actually quantified this potential. They moved it from an abstract concept to, an undeniable hard number.
Okay, let's hear it. The quantification is, frankly, breathtaking. They estimate that if we effectively scale these cost-effective brain health interventions globally, the result could be averting 267 million disability-adjusted life years, DALYs, by the year 2050.
Wow. 267 million. That's the headline number right there.
It's the single most compelling metric in the entire report, I think.
Okay, let's spend a moment on that number because 267 million is just staggering. But the term daily disability-adjusted life year, it can sound a bit bureaucratic or academic.
It can, yeah.
So for you listening, if you don't track global health metrics day to day, what does averting a DALY actually mean for a person?
Right. So a DALY is a standard global metric. It's essentially one lost year of healthy life.
Okay.
And that loss could be because life is cut short by premature death or because that year is spent living with a significant disability or illness.
Got it. So averting 267 million DALYs means
It means preventing 267 million years that would otherwise have been marked by debilitating illness or lack of productivity or even premature death. You're basically giving back healthy years.
that's a really powerful way to put it. Giving back 267 million years of healthy, productive existence. I mean, to put that in perspective, that's like reclaiming the entire healthy lifespan of, I don't know, a large European country's population.
Something like that, yeah. It signifies just monumental potential for individual health improvement on a global scale.
And that's the human side of it.
Absolutely. And the report really emphasizes this. This is the ultimate measure of impact. We're talking about dramatically transforming individual potential and quality of life all across the planet.
But the sources don't stop just there. They argue that the impact isn't only about the specific brain health conditions themselves. They point out this kind of dual impact.
Yes, exactly. That links it to those associated noncommunicable diseases, the NCDs.
Right. How does that work? How is a DALY number so big?
Well, precisely because it addresses two major burdens at the same time. First, obviously, you reduce the primary burden from the mental, neurological, and substance use disorders.
Okay, that makes sense.
But second, and this is critical, you reduce the associated NCD burden, things like heart disease, diabetes.
Wait, hang on. How does addressing brain health actively reduce the burden of, say, cardiovascular disease or diabetes? A listener might wonder, what scaling depression treatment has to do with heart attacks.
It's a deep connection, actually, and it's pretty well established in the research. Poor brain health thinking, chronic stress, depression, addiction often leads to behavioral factors.
Right.
Like poor diet, lack of exercise, smoking, things that are direct drivers of NCDs like diabetes, heart disease, hypertension.
Okay. The behavioral link.
That's a big part. But also, chronic stress and the inflammation often linked to mental illness can directly impact physiological systems too. Your immune system, cardiovascular system.
I see. So by addressing the root brain health condition, maybe you improve someone's ability to manage their diabetes or reduce blood pressure linked to stress.
Exactly. You improve behavioral adherence to treatments, you reduce systemic stress, and you sort of interrupt that cycle that drives those NCDs.
So we're not just treating mental distress and isolation. We're actually using brain health interventions as a lever to reduce the pressure on the entire chronic disease care system.
That's the argument. It's a truly holistic public health strategy.
Wow.
And by framing the impact this way, MHI and CHAI are showing this really clear pathway to, as they say, transforming lives on a massive scale. They're directly linking these targeted public health strategies to really profound, measurable human outcomes and economic ones.
Which brings us neatly to the core economic argument. This is what makes this deep dive feel, different. The sources present scaling brain health interventions not as some costly societal obligation.
Which is how it's often seen.
Right. But as a robust, maybe even revenue-generating strategy for driving economic growth and creating stronger economies overall, it's framed as an investment with real, demonstrable returns.
It is a profound shift in framing, moving from cost to capital investment. And when we talk about economic benefits, we mean tangible gains.
Like what, specifically?
Well, increased labor force participation, right?
Mm-hmm.
Fewer people disabled by their condition means more people working. Reduced presenteeism.
Presenteeism. That's when people are physically at work but not fully functioning because of illness?
Exactly. So people who are working are significantly more productive. And then, of course, reduced reliance on costly, reactive emergency health care. Catching things earlier is cheaper.
That reduction in presenteeism seems huge. We often focus on absenteeism, people not showing up, but having workers mentally present and functioning optimally. That's a massive productivity unlock.
It really is. It goes straight to the bottom line of a nation's economy. And the report details this new perspective on the economic impact region by region, which is essential for policymakers, who are struggling with tight budgets.
They need the proof.
They need data to prove that money spent today on, say, early intervention for youth mental health will actually save billions in healthcare costs and lost productivity down the road.
Okay, but here's a question then. If these interventions are so demonstrably cost-effective, meaning the benefit-to-cost ratio is strong, Why haven't they been scaled already? What are the barriers the report hints at?
Yeah, that is the necessary tension, isn't it? The barrier often isn't whether they work. It's implementation and prioritization.
Politics and logistics.
Pretty much. Historically, brain health just lacks parity in funding compared to physical health. And the immediate costs of scaling, training primary care providers, building community care infrastructure, integrating services, those upfront costs are easier for governments to put off.
Then visualizing the long-term economic gains.
Exactly. Those gains are complex and further down the line. But this report, this is the key. It provides the quantitative justification needed to overcome that kind of inertia. It puts numbers on the future benefits.
Okay, so if the data is so rich, how are the authors making sure this crucial information actually gets into the hands of the decision makers? The health leaders, the finance ministers who control the budgets. You mentioned some new resources.
Yes, they've gone way beyond just publishing a static PDF report, which often just sits on a shelf. MHI and CHAI developed a refreshed set of insights, but crucially, alongside powerful interactive tools, including dynamic dashboards.
Interactive dashboards. Okay, that sounds like a potential game changer.
It really could be, because it moves the conversation from these huge, abstract, global numbers to actionable local planning.
So what's the practical purpose? If I'm a stakeholder in, say, Southeast Asia or maybe Sub-Saharan Africa, how does this dashboard change my day-to-day decision-making process?
Well, the goal is basically actionable predictive intelligence. These tools let a user immediately filter the data. They can dive deeper into the expected health and economic impacts specifically for their region or even certain demographics within it.
So moving beyond just the global averages.
Exactly. They can input the current state of brain health in their own jurisdiction. That's the first step. And then they can actually model potential policy shifts.
So they can start playing out different scenarios like, what if we invest here?
Precisely. They can quantify the potential benefits of specific evidence-based interventions they might be considering. Let's say a health minister is thinking about introducing step care models for common mental disorders.
Which you mentioned is highly cost-effective.
Right, where care intensity only increases as needed. They could use the dashboard to model. If we invest X amount to implement this over 5 years, what's the predicted number of DALYs averted right here in our region? And what's the projected economic boost by, say, 2035?
That is extraordinary. It basically allows them to bypass a lot of the guesswork.
And provides the hard metrics needed to justify potentially large-scale capital commitment to brain health, a sector that, as we said, historically struggles to secure that kind of funding.
It turns a political argument, or maybe a purely humanitarian one, into a much more mathematical, economic one.
Exactly. It makes prioritizing resources potentially far easier and definitely more transparent. It helps leaders identify specific opportunities for action that are actually relevant to their own geography, their culture, their existing healthcare infrastructure.
It's the difference between just writing a white paper and providing a real strategic planning application.
That's a good way to put it.
So what does this all mean then, pulling it together? Documents, these new tools, they're essentially a high-level strategic operating guide.
Pretty much, yeah. For any government or major organization that's serious about unlocking future economic potential by improving fundamentally their human capital through brain health.
Right. Health as human capital.
The ultimate goal is crystal clear. Guide stakeholders to prioritize brain health as both an urgent public health necessity and an absolutely essential component of economic development strategy.
Two sides of the same coin.
They argue they are. And they're providing the map, the metrics, and the modeling tools needed to justify that major necessary shift in focus globally.
And the case they present is comprehensive, it's evidence-based, and it's backed by that massive potential quantifiable return, reclaiming those 267 million years of healthy, productive life.
That's the synthesis of everything we've discussed, really. The sources present this urgent, evidence-based case for shifting resources decisively towards scaling brain health interventions.
Driven by the huge human potential of DALYs averted.
And the subsequent boost this provides to global and regional economic growth. This report, it really aims to firmly establish that sophisticated health strategy is sophisticated economic strategy. They are intertwined.
So thinking about the listener now, if the evidence from this MHI report detailing this transformative potential, 267 million DALYs averted, outlining a specific economic benefits, if it's all so clear, What critical steps must you listening, or perhaps your field, take next? How do we move beyond just knowing this into comprehensive, cost-effective action?
That's the challenge.
Yeah. Imagine you have access to that MHI interactive dashboard right now. Which single intervention would you model first for your community, knowing that every daily averted is both, a life improved and a quantifiable boost to the local economy?
It forces you to prioritize based on potential impact.
Exactly. That's really the challenge, I think, that MHI and CHAI are setting before the world with this work. Where do you start?